Hello, everyone. My name is Jalen Jones here with Grace Haba. We're going to talk about a lot of cool things today dealing with weight loss. First of all, if you're watching this video, like and subscribe. Follow for more. We're going to get content that you can't get anywhere else. So, Grace, let's start from the top. What is going on here? There's addition of a pill, Wegovy. What's going on here?
Yeah, pretty big week for weight loss medications. I think all of us have seen kind of the rise of GLP-1 medications in popularity over the past few years. But up until this point, that's largely been centered around the injection type of these medications. Yes. And now, as of this week, Wegovy has come out with, or rather, Novo Nordisk has come out with a pill version of Wegovy. It still uses semaglutide just like the injection, but instead of a once monthly injection, it's now a once daily pill. So it really is expanding access for people. It's about $50 in general less than the injection version of it. So it still is pricey, and we'll get into that in a little bit. But in terms of getting this medication into the hands of people who need it, any competition is going to help drive that price down. So having more options on the marketplace is going to do just that. And that's what we're starting to see as these drugs kind of start to drop in price. But the biggest thing is, again, instead of it being a once monthly injection, you now take this pill once a day. The injections, they need to be refrigerated.
They do.
And so with the pills, they don't. So not only could you kind of be a little bit more discreet maybe in your own house with whether or not you're on these medications. If you have people over, you don't want them to open the fridge looking for milk and see your Wegovy injections. Now you can kind of keep those in your bathroom cabinet or something like that. So it kind of adds a little bit more anonymity behind some of these medications and might help with the stigma around whether or not people are on them. And also, too, it can help with people who just have dexterity issues, maybe aren't comfortable around needles. That all goes away if you're taking the pill form of 100%. These medications. Yeah, so again, it's just providing more options for people who could benefit from being on these types of weight loss medications.
Yeah, personally, the idea of stabbing myself once a week, I can't do it. But I'm really glad people have more options. And to cover you in this story, 1.5 milligram starter dose starts at $149. 4 milligram dose costs the same amount until April 15th. The price will increase to $199. The 9 milligram and 25 milligram doses cost $299 a month, according to the manufacturer on that. Kind of affordable. I'm not going to lie, it's kind of affordable. And,
when you look at it in the grand scheme of things, I mean, these medications started at more than $1,000 when they first really came onto the market. And now we've seen them range to just a couple hundred, right? And that is still a hefty bill for patients paying out of pocket because a lot of commercial insurance companies don't cover GLP-1s at this point, largely because of that cost. It's something North Carolina has dealt with as well. We've covered it in terms of state insurance and Medicaid working to provide broader coverage of GLP-1s. It all has to do with cost, what the manufacturer is asking from insurance companies, what insurance companies are willing to bring to the table, and that often trickles down to what patients themselves can afford. So yeah, we have seen these drop several $100s in price, but for some people, that's still too much, right? So if you do have insurance, you might be looking at closer to $25 a month for this new pill version or the injection. But a lot of people don't have insurance helping them out. So we're going to have to see if more of these drugs coming onto the market will continue to help drop that price, and if insurance will kind of foot the bill.
We know how competition works in the marketplace. Let's talk about, are there similar results for the injection and the pill? Are there any new side effects to taking the pill? Because it's going in your bloodstream. This one's going in your stomach. What's going on here?
Yeah, so Novo Nordisk, it's right up the road in Clayton. Their main U.S. manufacturer. They're the ones kind of rolling out a lot of these drugs that we're seeing right now in terms of the pill and the injections. They came out and said that the clinical trials of the Wegovy pill were very similar in terms of results to the injection. So it also found that the side effects were very similar as well. Nausea, vomiting, those are kind of the most common side effects we see from people who are on these types types of GLP-1s, and that's what they found as well with the pill form. And according to the study data, just giving off some numbers here, 7% of those in the pill trial stopped because of the side effects. So you still have 93% of people who continued on, and 6% of those in the placebo stopped. So that's a 1% difference in terms of people who actually were on this medication who stopped because of the side effects, and those who were given a placebo and stopped because of what they believed were side effects, right, from this medication. So it is very similar to what we're seeing in terms of the injection just now in a pill form, which is good for those wanting to try this. Maybe we're on the injection and feel like, okay, well, this is working for me, but I'm nervous about switching because what about new side effects? So this is good news for those folks, and also for those who haven't yet started GLP-1s. And like we talked about before, maybe this pill is going to provide them some more comfortability starting that conversation with their doctor.
I'm telling you, it's the mental hump of, I could just take a pill rather than the injection, those things. Also, I find the studies fascinating as well, especially people that get placebos and things like that. I wonder how that works. We can nerd out about that another time. All right, so let's talk about is there a catch?
Yes. So with this being a once daily pill instead of a once monthly injection, it's using the same active ingredient, semaglutide, but it's obviously being delivered into our bodies in a different way. So the injection, to your point earlier, goes right into the bloodstream once a month, whereas a once daily pill needs to be formulated to survive the acid in our stomachs and then be absorbed into our body. So the pill is slightly different, and for that reason, it does come with food and water restrictions around when you're supposed to take it. A local doctor with UNC Health, weight management physician specifically, told me that this pill is advised to be taken normally in the morning on an empty stomach, which is unique because I feel like we normally hear with medication to take it with food. That's not what they're saying here. Take it in the morning on an empty stomach with no more than 4 ounces of water. And they say you need to swallow it whole, not crush it up. So there are some caveats to the pill that maybe wouldn't immediately come to mind for some folks.
Instructions.
Exactly. Of course, that's what is the general consensus, but as your doctor prescribes you this for individual needs, that might vary. But that is kind of the biggest difference between the pill and the injection. And the reason because of this is it's a peptide. And so this is why right now the pill versus injection and what we're going to see in the marketplace over the next few months is likely going to continue to evolve. Novo Nordisk, not the only company coming out with a weight loss pill this year.
Yeah, for
Eli
sure.
Lilly, just around the corner, is supposed to get FDA approval for its version of a pill, and that one is going to be different. Doctors I spoke with said that one is going to be formulated differently, doesn't use a semaglutide in terms of being a peptide. It's going to be more of a small molecule base, and so therefore it's not going to come with a lot of these food restrictions. That one is also expected to be cheaper to make. Excuse me, I almost just choked. That one is also expected to be cheaper to make, so we do expect to see that influence the market prices of these drugs. Again, that's expected to happen over the next few months.
I think this is the best thing for consumers, trying to get the best product out there, the most feasible thing. I think that's going to be best for consumers. And also shout out to the fact that stuff is being made local. This is helping the local economy. So
it is really interesting that, North Carolinians right up the road from where we are, or where millions of doses of these medications are being made. So it's providing job opportunities for people here in our area, and to your point, contributing to our local economy as well.
So let's switch gears a little bit. Let's talk about the lifestyle aspect. 1 in 8 U.S. adults say they're currently taking one of these medications, according to KFF, a health policy research group. Is this a new way of life for Americans? You're talking about this is becoming in almost like exercise and things like that. This is like a new way of life, a new trend. Am I on the right track there?
You definitely are. I mean, anyone. You open your phone nowadays and you see so many people saying that they take weight loss medications. And I think we're at that point, too, where with more prominent figures, Serena Williams, for example, right? Such a fit individual coming out saying she uses GLP-1s. no one would look at her and say, oh, well, she doesn't try hard. She's not fit. She's not active.
She's a world-class athlete.
World-class athlete. And so the more that you have people like that coming forward, kind of explaining what's worked for them and why they've turned to these medications to help them, through lifestyle changes, I think it's helping break down that stigma barrier and allowing everyday patients and consumers to feel more comfortable opening up to their physician, asking, hey, is this right for me? What do you think? I've tried this diet or I've tried this exercise routine and nothing seems to be sticking.
Yes.
Is a GLP-1 kind of that missing piece of the puzzle for me? Because again, GLP-1s are not the only thing someone needs to be doing. You need to be taking these in a long-term approach mindset. These are not a quick fix, and they should be done with exercise and behavioral changes and dietary changes and really making sure that they're aiding in your weight loss journey, not running the entire thing. And I think people also need to understand that with the pill and with the injection, if you get off of these, if you're looking for just a quick fix, you want to drop a couple pounds, right, you're likely going to gain that weight back. This is meant to be a long-term solution for people who are at risk of things like hypertension, cardiovascular disease, suffering from other chronic conditions that are tied to obesity, and this is one of those ways that they can help manage a host of different things rather than only looking at your waistline. So I would encourage people who are thinking about starting GLP-1s,
Yes.
always talk to your doctor. You need to start there. And a local physician, like I mentioned with UNC Health, says that she advises people to make those appointments in person too, which I found fascinating because in the world of telehealth, it's a lot easier,
Yes.
to get in front of a doctor, but it really is important to have that face-to-face conversation in person with a provider and really talk about what your weight management goals are and whether or not this is right for you.
I had a family member on a GLP-1. Is that how you say it?
Yes.
She lost too much weight and had to get her off because there was starting to get some health complications because there wasn't enough weight.
Yeah, you also need to manage muscle mass and things like that, which is where that exercise and the dietary component really, really play a big role.
Exactly. She was losing muscle mass, did not exercise. We had to get the protein up, all those other things as well. So let's wrap up real quick. Here's a quote: obesity is a very stubborn disease. Let's expound on the fact that obesity is an illness, because I think I have to rewire my brain a little bit with that. I think obesity is like, oh, I'm just big. Oh, I just a big back. Is that what everybody's saying? But obesity can be a disease.
It absolutely is. Yeah, it's so much more than just what you see when you look in the mirror, right? It's labels that historically society has put on people who don't fit this quote unquote mold that we believe everybody should look like, or you should believe, or you should be. Health is so individual. It is not the same for me as it is for you. It's not the same for any of our other coworkers, right? We're all individual, and what being healthy means for each of us varies so much off of our demographics, our race, our height, our gender, everything. And so we need to be careful when it comes to what we're saying in society in terms of this is what healthy means and this is what you need to be. And that's especially true with GLP-1s because, as I've been saying, they're not right for everybody. If you are looking just to drop a couple pounds, there are other ways to do that don't come along with kind of these other effects of stopping a GLP-1 medication. And that's where having those open and honest and continued discussions with a licensed physician really come into play. And this, again, it needs to be done with behavioral changes, lifestyle changes. This is now going to be part of your daily routine if you start taking one of these pills, or monthly routine for the injection. And you need to make sure that you're following what you need to do with these. And it's not just a simple, okay, I'm going to start this, everything's all good. It does require a long-term commitment from you and understanding of the impact of the medications on your life.
Well, if you're considering a GLP-1, please talk to your physician. Do not hop on the wave. Also, talk to your physician. Don't talk to ChatGPT, please. Talk to a human being about these things. And wish you the best on your journey. Again, if you're watching this, like and subscribe. Follow for more. And Grace, thank you so much for your time today.
Of course, happy to be here.
Okay.